How long after rhinoplasty can I work out? So all of these questions are very specific to the surgeon and their post-operative instructions. So make sure you ask questions with your surgeon before you have surgery, and you read their post-operative instructions very carefully before and after to make sure you're following the rules that they have set for you and for your surgery. Not every rhinoplasty is the same, and they don't necessarily require the same amount of time. I will give you generalizations for how I advise my patients, but definitely ask your surgeon and make sure you're following the instructions that they had set forth for you. So after rhinoplasty, I tell my patients you can walk for as long as you want to, but I don't want you to get your heart rate up for the first 10 days. So nothing that would get your heart rate up. Don't walk too fast, but you can walk as far as you want to. After 4 weeks, you can start working out. So you can start doing lower body weight training. You can start doing bikes. You can do elliptical machines. You can do things that will get your heart rate up and put stress on your lower body. After 6 weeks, you can do things that put stress anywhere on the body, upper body, lower body. So you can work out in your arms, your shoulders. You can do weight training on your upper body. You can do impact exercise like running. After 6 weeks, you're pretty much back to normal as far as exercise goes, and you can get back to your normal routine. Go back slowly, however, because your body will tell you if you're going too hard, too fast. You will feel it in your nose. You will feel a throbbing in your nose if you've done a little bit too much. Just back off, and the next day, just take it down a notch whenever you start working out again. When can I blow my nose after rhinoplasty? I'm most particular about blowing the nose if I have done a septoplasty with the rhinoplasty, but with both, I ask you not to blow your nose at all for the first 10 days. We have a little drip pad that is a gauze on tape underneath your nose that catches anything that may drip, and you just let it drip onto the drip pad. After 10 days, you can blow gently out of both sides, and then after 6 weeks, you can hold one side and blow, or blow any way that you normally do. When can I take a shower after rhinoplasty? This may vary from surgeon to surgeon depending on what their preferences are. My thing is I do not want you to stand in the shower and let water run on the splint that I've placed during surgery. So you can get in the shower starting the next day. Point the water down, wash your body, turn around and wash your hair. And if little sprinkles of water get onto the splint, it's not a big deal, but if water runs on it, that splint is gonna fall off, which is not ideal. Other surgeons may ask you not to shower for a certain period of time, to do baths, to wash your hair in a sink, things like that. For the most part, the main idea is not to let a lot of water onto the splint to make it fall off. When can I touch my nose after rhinoplasty? Whenever we take off the splint or the tape. Personally, I put on a splint for 5 to 7 days, and then I put tape on the nose until day 10. Not everyone tapes until day 10. Some surgeons take off the splint at day 7, and then you don't have anything on your nose. Once you don't have anything taped on your nose, you can touch your nose. You will know how gentle to be with your nose based on your own discomfort, because it is going to be sore for a while, for 6 to 8 weeks, up to a couple of months to 3 months even. So touch it gently. Once the tape comes off, you can put on makeup, you can wash your face, you can touch it. Everyone wants to touch it a lot. You're gonna end up touching it, and you just do, because it's new, it's different, it feels weird. That's what everyone does. But as soon as the tape or the splint is off, you are okay to touch your nose. When can I pick my nose after rhinoplasty? Please don't pick your nose after rhinoplasty. This is where you can come into complications like the septal perforation or problems with healing. You want to be very careful with your nose after rhinoplasty. It may feel like you want to get the stuff out of there because you will have drainage, you will have dried blood, you will have stuff in your nose that you really want out, but keep that moisturized with the ointment that your doctor provides you with and the saline rinses, or if they have any other instructions. But please try not to pick your nose at least for 8 weeks after surgery, and talk to your surgeon about ways that you can help clean your nose out otherwise. Have questions, call or email anytime. I would love to hear them and set up a consultation. Thanks for watching.